Now it is Senator Kaine.
You, Mr. Chair, and to the witnesses, I'm really happy we're having a hearing on this very important topic. I'd first like to introduce into the record a letter from one of my FQHC's paths, the Piedmont Access to Health Services, FQHC in Southside, Virginia. I'd love to enter it into the record, Mr. Chair.
Without objection.
They talk about the fact that they use their 340B dollars to invest directly into OBGYN care after hospitals in the area stopped taking obstetric care, stopped delivering babies. And so PATHS delivers about 500 babies a year and 7,000 OBGYN visits, picking up from where the rural hospitals have not been able to figure out how to make it work. Just one thing, we're talking about where we are, and I'll just say in Virginia, over the 24 hours between Tuesday night and last night, 400,000 people received notice about what their health care premiums will be on the exchange. And their reaction is, this is a really big bill, and there's nothing beautiful about it. The increases are dramatic, and I do hope we can work to ameliorate the suffering that these families are going to experience. The 340B program is really important. I'm glad to join with Senator Baldwin and 3 Democratic and 3 Republican colleagues on the working group looking at reforms. And, you know, I think we're making some real progress in response to what Senator Marshall urged earlier. We're making some real progress, and my hope we can close the gaps to do some of the things that you suggest. And I just want to talk about the FQHCs. I was at an event with an FQHC in Buckingham County, Virginia, not long ago to announce some expansion of their ability to do early detection of breast cancer. And what they said is the FQHC, and they have 20 sites, it's a sizable one in Central Virginia, their financial model is a 3-legged stool. First, federal funding through HRSA for community health centers. Second, reimbursement for services provided to patients that have health insurance, especially Medicaid and the ACA marketplace coverage. And then third is 340B savings. These are the 3 pillars that they use to operate and serve. This particular FQHC serves about 45,000 patients, 170,000 patient visits a year. They're worried that all 3 of these pillars are in significant danger. So first, the HRSA. While there hasn't been HRSA grant cuts yet, there have been significant staffing cuts in HRSA. And so Ms. Rosenberg talked about the need for HRSA to do more documentation about these contracts, more audits, more assessments to get information to be more transparent. You're not doing that if you're shrinking a staff that already didn't have enough resources. And of course, the FQHCs are worried about what budget cuts might be coming down the path through their HRSA grants. Second, the second pillar is Medicaid and Medicare services. And obviously the big bills promotion of cuts in these areas, ACA market tax subsidies immediately and other Medicaid cuts down the road are causing them huge concern as they look at their future. And then finally, the second one, or the third stool is this 340B program. And my colleagues around the table, and I think this is pretty bipartisan, the focus on FQHCs from both sides of the aisle is whatever reforms we do, we have to make sure that they work for our FQHCs. They can't undermine the work that they do to help low and moderate income people every day. So for our FQHCs, these 3 legs of the stool, HRSA funding, Medicaid, Medicare reimbursement, and then the 340B program, they all work together. They're not the only issues that are important as we have this discussion about lowering healthcare costs. But these are the 3 pillars of our FQHCs, and all of them are facing some significant jeopardy now. And that's why I'm so happy that I am part of this bipartisan working group to try to find the right reforms to deal with some of the concerns you raise, but preserve this program for those who need it so desperately. I'm mindful of the fact, Dr. Sen, you've sometimes said, you know, we don't offer policy advice. Just for the audience, the CBO is not in a position to just freelance opinions. That's not what they do. If we put proposals on the table and we ask them, what effect will this have, then they do a study and they make a suggestion to us. So I didn't want folks to think that Dr. Sen was sort of unwilling to play along with the questions. That is an institutional role that she has to respect, and I respect that. But for each of you, within your own sort of expertise and as you can, what would you tell the 6-member working group that the main focus of our reform efforts should be? And I'll start with Ms. Rosenberg.
Thank you for the question. I would encourage you to look to our recommendations to HRSA. I would note that an earlier discussion draft that the working group put out did address, or appears that it would address many of our recommendations, but we're certainly happy to work with your staff as you proceed to review your language and see if there's other recommendations.
And although that HRSA report is now a little bit dated, those are still recommendations that you think are really necessary.
Absolutely. 15 of them are still open, and we would certainly encourage you to address them. Some of them have been things discussed already today, clarifying the definition of patient, ensuring that duplicate discounts are addressed, whether they're in fee-for-service or in managed care, making sure that entities are actually eligible to participate.
I'm sorry that I have not left time for Dr. Sen and Feldman to answer that, but I have a feeling some of my other colleagues may ask that same question. Thank you.
Senator Collins.
Thank